Guys, thanks so much for being with us today.
Great to be here. Great to be here.
First of all, tell us where you came up with the name.
Well, both Brad and I did our residencies at Harlem Hospital in New York City. And so the Harlem Renaissance is real near and dear to both of us, the tradition of the Harlem Renaissance. And so from that name, we picked Renaissance Endodontics for our practice.
All right, guys, let's talk a little bit about endodontics. Is that not just a fancy word for root canals?
Well, actually it is, and a lot of people are afraid of the word root canal.
Yes, they are. I'm one of them.
It's one of those scary things, but we try and make folks understand that it's not as scary as it used to be in the days of the past. What it actually is cleaning out and disinfecting the entire canal system of the tooth and diseases of the pulp, which is the nerves of the tooth.
How do you make them feel comfortable and help them along this process?
Well, we try and maintain a spa-type atmosphere as far as our practice goes. You need a level of comfort to understand that we do care about the problem, we do understand you're in pain, and we want to help you as best we can.
What does that mean, a spa-type atmosphere?
What that means is the use of aromatherapy in our office. Patients are greeted at our door with a fountain that is cascading down in the waiting area.
You've got to be kidding me. Aromatherapy? I love that idea. That's great. How does this work?
The thought was just to try to get a patient away from the ideal of coming to have a root canal done. The thought was to go to a spa. We all like the spa.
Absolutely.
What happens is when a patient comes in, they're generally nervous, as should be expected when you're coming in for an appointment to have a root canal. So what we do is we try everything that we can to get the patient's mind state at a place where they're calm and relaxed as opposed to tense and anticipating some type of painful event.
When do people come to you? Is it when their jaw is out to here and they're in a lot of pain and their family practice dentist says, you know what, you guys got to go see a specialist?
You got it right on that part about the general dentist sends to us and refers to us. We do not want to see them until their jaw gets to that point. We would like to see them when they're pain-free, but many times we can detect a root canal problem or an endodontic problem before they get to the point of swelling.
Okay, why did you guys want to set up here in the metropolitan Detroit area?
Well, this is a place that's near and dear to our hearts. We're being from the metropolitan Detroit area. We felt the need to come back home from New York and after we finished our specialty programs to treat our neighborhood, to treat our families.
Gentlemen, thanks for being with us. You've certainly enlightened us in an area that certainly scares a lot of people. That's getting the old root canal. Dr. Todd Ester and Dr. Brad Griffin from Renaissance Endodontics, right here in the metropolitan Detroit area. If you'd like to hear more about these guys and our other dentists we've been talking to, please give us a call or contact our website. Thanks, guys.
Thank
you.
you. Thank you.
There's nothing like having a confident smile. Healthy teeth and gums can boost that confidence.
Welcome back. Well, while doing this program, I had a chance to meet some terrific dental healthcare professionals in our area, and I got to tell you, I was amazed at some of the things that I didn't know. Let's find out more right now. Very, very happy to have Dr. Keith Kelly with us today. Dr. Kelly's office is located in Troy, and one of the things we haven't talked about so far yet, and you deal with this a lot, and that's laser treatment. Tell us a little bit about that and about your practice.
Well, geez, lasers have really come to the fore in dentistry now. You can use lasers to not only detect the cavities, but treat them at an early stage, or use a little air abrasion, which is kind of like a dental sandblaster, way before you need to use anesthesia. So that means you can fix cavities without shots.
Okay. I was going to say that it sounds like, and I think this is going to be a very nice thing for dental patients, that you're eliminating as much pain as you possibly can.
Oh, absolutely. We have anesthetics that numb people up as more than they've ever been before. We have topical anesthetics that often will take the place of anesthetic, the injectable type of shots.
Sure. I think a lot of people still are afraid to go to the dentist. When you see a patient that literally is afraid, how do you go and calm that patient down to make this experience very pleasant?
What we try to do is we try to make anybody who calls into the office, actually part of our family as well. That means you listen to them.
Sure.
You focus on what they're saying. You find out whatever it is that they want and do what you can to deliver that.
I mean, everybody wants a nice, bright smile.
Absolutely.
And now, in this day and age, you can do that.
Sure, sure. And we can give them a simulation, before it is actually done.
That's amazing.
We can do just like in your industry, we take the digital photographs, and we can modify those photographs, create the smile that they want, and then plug it right back into their smile or into their face and say, is this what you were looking for?
Dr.
Great.
Kelly, thank you very, very much.
Absolutely.
And we'll be right back. Thanks.
There's nothing more frustrating and distracting than having a toothache. Thank God for Metro Detroit dentists.
Okay, this is great. Now look, if you need a dental health care professional, be sure to write down the phone number of one of the professionals you're seeing on this program, or contact us through our phone number or our website. Right back. Dr. Nicole Fields is with us now from Fields Best Dentistry. I love the name of your office. How'd you come up with that?
Well, I feel like I want to give my patients the best care. I want them to feel comfortable when they're in my office. So that's how I put it together. I want them to feel good when I give them the best dental treatment.
Where does that feel good feeling come from? The minute your patients walk through the door?
Exactly. I have a wonderful team that works with me. They are very customer service oriented, and so they always make they always greet the patients with a smile. So I think that's very important.
Dr. Fields, you I think are in somewhat of a unique position because you also taught, especially some of our younger members of the community, dentistry. Tell us about the importance of that as well.
Well, I really enjoyed, for the past 10 years, I was a clinical instructor for the University of Detroit Mercy. So I was basically a mentor over the senior dentists to make sure that they were doing the best, giving the best treatment to low-income patients. So I think it was important to emphasize public service to the students, as well as to provide a service to patients who will not have insurance, will not be able to receive care.
Doctor, tell us a little bit. You're kind of innovative in this area. Tell us a little bit about your inexpensive method of creating records. This is important.
Well, along with one of my referring specialists, she has given me the opportunity to receive training to offer my patients electronic records. So that way they can have photos of their teeth, their x-rays, even DNA samples, and models of their teeth. So that allows them to carry the records with them to another dentist's office. They can even bring the information to their physician. So it's very inexpensive, and it is, like you said, it is cutting edge.
Boy, things have certainly changed over the years, and I might say for the better. You really enjoy what you're doing, don't you?
I do.
Yeah, I can tell. I can tell.
Thanks so much for this opportunity.
Thank you for being with us. And if you'd like to get a hold of Dr. Fields, our number is right on your screen, as is our website. We certainly hope that you'll give us a call and visit our website. Thanks again, Dr. Fields.
Thank you.
Appreciate it.
I like going to my dentist. He makes me look so pretty.
Yeah, right.